Although high-frequency ventilation seems very new, the idea that rapid, shallow breaths might be an effective way of breathing was first considered in 1915 by a scientist and researcher named Henderson. He noticed that when dogs pant, they don't hyperventilate because they maintain a small amount of pressure in their airways all the time, like a partially inflated balloon, and move small amounts of air in and out so fast that the airway or balloon never expands or collapses all the way. It is with this gentle breath of a butterfly, as delivered by the 3100 HFOV, that even the smallest patients, born very early and weighing sometimes under 2 pounds, are assisted. Austin Eddy was one such baby.
And that he wouldn't make it through the night if we wanted to spend some time with him and then sign consent forms to take him off life support. Without even looking at my wife or asking her, I told him, no, we're not going to sign anything. Just do what you can and we'll do what we can. Knowing that Parkland Hospital is one of the best hospitals he could have possibly been born at that point in time, a whole new game plan took place.
You know, as a parent, you don't do that. You don't give up, you know, when there's problems. And so we didn't.
When he was born, he actually fit in the palm of your hand, minus his little feet hanging off the palm. But by the time we got to hold him, it was maybe 5-6 pound baby, at least big enough to hold.
The first ventilator that they put him on was the high-frequency oscillating ventilator. And, you know, I don't know a whole lot about the machines. They told me that it worked in a special way versus other ventilators. It worked completely different, and it was specialized for his little lungs.
I had just a special bond with him, just mainly because I knew his family, and he was a unique little guy, and definitely thrived.
I knew from when they said it's touch and go, he won't make it through the night. Well, the next morning he was there, and I said, he's gonna put up a fight on this one because, you know, he's doing what doctors that have so much education and supposed to know what they're talking about, he's proven them wrong. So he was a fighter from the beginning.
As soon as Austin was progressing, he definitely had a personality come out. I'd hear bad news about him, it would really affect me. I really worried about his future.
Every day he got stronger and he got bigger, and every milestone, you know, he got off of the high-frequency ventilator. And then he was able to move off of the ventilator onto room air, and you know, he had to be put on the nasal cannulas, and so he kind of graduated in steps.
Everything was, once he left NICU, I mean, it was just like a normal kid. Just watched him grow. He'd smile and laugh and play, just like any other kid.
My best wrestling move is the RKO. When I grow up, I either want to be a police officer or firefighter. Because when I'm a firefighter, I can save lives, and when I'm a police officer, I can take the bad guys to jail.
In 2007, news of using the 3100B HFOV for pediatrics and adults was circulating in the respiratory care community. It was not a commonly used option at that time, but for Andrew Hoyt, it was the only option left.
Actually, for graduation for his birthday on July 22nd, he had turned 18, and for his birthday present was skydiving. And so me, his brother, brother's girlfriend all went skydiving, and one of his best friends, and that was probably one of the last times as far as being really, really healthy. It was just a good moment where we were just kind of all together.
I had braces, and I got the braces off not knowing I had mono. And I guess the bacteria went into my system, giving me strep and staph infections, which gave me the severe pneumonia, which developed into an ARDS. And I remember talking on the phone with her, complaining, my back kind of hurts.
So he went to the doctors, and came back and the doctor just said, you know, you just need to get bed rest, take Tylenol and Motrin every couple of hours, and that should take care of you. Well, the condition persisted, and we kept taking him back until finally Andrew said, I want to go to the hospital.
They told me I had pneumonia at this point. They told me to try and cough. Every time I would try and cough, I would burst out into tears. That had to be one of the most excruciating pains of my life. I couldn't breathe. I remember them putting the bag mask on my face. I still couldn't breathe. And they're sitting there rushing me up to the ICU. My mom's yelling at me at this point because she's so freaked out. Just breathe. I mean, those words echo sometimes in my head, just breathe, because, I mean, that's all I had to do was breathe. I mean, it shouldn't be that hard. I mean, we do it every day. But it wasn't an option. The harder I pulled for a breath, it just wouldn't happen.
By the next morning, Dr. Utsurum called me, one of his nurses called me on the phone and said, hey, you need to get in here right away. Your son is in respiratory failure. And I thought, what?
And I remember looking up at the ICU lights, my brother, my dad, and my mom out in the hallway. They were right outside the ICU room staring in at me. And then the lights went out.
So we, intubated him, worked him up, and he had very extensive comorbidities. He developed sepsis, full-blown DIC, renal problems, cardiac problems. And then he developed some what we call bulla, pneumatocysts in the lung, which most likely was related to the pneumonia. And because of the ventilation that he was getting, these pockets ruptured on both sides, creating a massive pneumothorax, which is another word for collapsing the lung on both sides. He progressively just deteriorated to the point where with the chest tubes in place, we still couldn't ventilate him. The air was just going in from the ventilator into his chest, into his lung, escaping. So it's just going this way. It wasn't exchanging.
But when the doctor came out, he said, this is not going to go on much longer. You understand that you're going to need to say goodbyes to Andrew. And we're like, as a parent, you don't give up, right? You don't give up until there's nothing.
The head of Respiratory came up to us and said, we've got one last chance. He says, I've been reading about the high-frequency oscillating ventilator.
Our only last-ditch effort here was to give it a shot. We were not really very hopeful because he was in full-blown multi-system organ failure. HFOV is really a classic treatment for respiratory failure, wherein you have to deliver the air in minute increments so that it doesn't go out. It just kind of flutters in. So that if you have that in the lung itself, you have a chance for the oxygen to cross.
We put him on, and actually our oxygenation improved pretty much within the first 4 hours. We've seen an improvement in oxygenation. But because he did have the multiple chest tubes and he did have bronchopleural fistula, it was difficult to ventilate him. But it took over the next 24-hour period, we were able to ventilate him successfully. His CO2 levels began to come back down to normal, and his oxygen levels increased, and we're able to decrease his FiO2 on HFOV.
After about the third or fourth day, there was a gradual, real slight improvement.
So we progressively were able to maintain his lung function while waiting for the other comorbidities to be cleared. So those subsequently fell into place. The cardiac status improved, the sepsis improved, the bleeding improved.
They pulled me aside, and I remember Dr. Bassi, looking at me. And he said, he's going to make it.
And I was able to talk. I had my trach out at this point. And I was just talking with one of them, and I think they were kind of joking with my family at the time, and me saying, hey, like, wouldn't it be cool now that you went through this if you became a respiratory therapist? And I was like, you know, I kind of joked with them, laughed about it, and said, yeah, that would be. And it didn't even cross my mind at the time. Like, it didn't even hit a serious note. I wasn't like, yeah, let's go do that. But then down on my road to recovery, I started thinking about, you know, what am I going to do? What am I going to do with my life? And I was like, you know what? One of them said I should check out respiratory. I kind of like that job, like knowing from what they did with me, having them work on me. I thought they were really cool people, and the more I looked into it, I was just like, this is where I'm supposed to be.
And he's really focused on giving back and caring.
It's amazing how this machine works. Instead of blowing holes in my lungs, it held them open. It was what kept me alive. And so being able to work with the machine and also save infants' lives with the same machine that saved me, it was a really cool experience.
I think he knows down the road that there's going to be families that are going to be looking for some hope. And he knows that his story with the high-frequency oscillating ventilator is going to give that family hope.
And just be able to really relate with what they're going through to help them through such an intense time in their life, an intense crisis.
I knew he had been been accepted into a respiratory therapy school, and then we were really surprised because then he came here. It was his first rotation as part of his clinical rotation, and so the staff was really excited, and it was just really neat that he actually came to our facility to get his training.
When you think about the fact that he had no chance, and this doctor actually had the forethought to get this HFOV. I think he said he'd read a paper on it, and that's how he knew about it. And so if that hadn't happened, right, then what? So that's why I say it was a miracle from beginning to end, everything that happened with him.
In the United States, the 3100A high-frequency oscillator ventilator is the standard of care in the majority of Level 3 neonatal intensive care units and pediatric intensive care units. It is perhaps the most studied and researched ventilator on the market today. Miracle is the favorite word used by patients and families of those treated with the 3100A or 3100B. So, what is a miracle? It used to be defined as a positive event that defied the laws of nature. Now, miracles happen when skilled people and advanced technologies work together to accomplish something more than what was considered possible before. CareFusion 3100A and 3100B high-frequency oscillator ventilators.